Hello everyone, this presentation is to introduce lean management. The following slide will refer to the University of Texas at San Antonio, Frank Chan, PhD. He is a Lucia Brown Distinguished Chair Professor at the Center for Advanced Manufacturing and Lean Systems. The STEEP principles are described by the Institute of Medicine in Crossing the Quality Chasm, a new health system for the 21st century as an appropriate model for the delivery of excellent patient care, safe, timely, efficient, effective, equitable, and patient-centered. Challenges of United States healthcare system: safe, 50,000 to 100,000 or more lives are lost each year because of medical error. 42% of respondents to the public survey reported experience with poorly coordinated, inefficient, or unsafe care. Timely and estimated 16 million Americans are considered underinsured because they have high out-of-pocket costs relative to their income. Difficult for individuals to obtain needed health care, burden them with large medical bills when they do receive care. Efficient. 3/4 of adults in the United States believe the United States healthcare system needs either a fundamental change or completely rebuild. Like expanding insurance and controlling costs should be top priorities for federal action. Health problems among United States working age individuals and their families cost an estimated 260 billion in lost productivity each year. Effective: 45% of recommended care is not provided without regard to plans or type of insurance payment. Medicare and Medicaid, which pay for about half of the compensated care in the United States, do not significantly reward higher quality care outcomes and clinicians. Equitable: nearly 47 million United States residents do not have health insurance, 1.4 million more than in 2006, which according to the Census Bureau 2006 annual report on the well-being of Americans represents 15.9% of the United States population. Patient-centered: 500,000 income and low-income families reported serious problems paying for health care and insurance coverage. These challenges drive us to the question of how to reduce the waste, error, and cost found in the healthcare system. What is lean? Waste, your waste, and waste, another waste, reduction. Waste, first the value. In general, only 10% to 30% of work is value added. Lean: elimination of non-value added waste activities. Lean can help us do more with less. Let us get more out of our current resources, effective in our work area. We will not put into our establishment anything that is useless. Origins of lean manufacturing: 19 to Sakichi Toyota introduced the automatic loom. 1913, Henry Ford invents the assembly line. 1950, E.G. Toyota visits Ford plant, returns to Japan and develops the TPS Toyota production system. 1992, the machine-led change the world. MIT, Massachusetts Institute of Technology, Boardman and Jones, 1996. The environment, core values, job security, problems are good, floor level involvement, value add support, value add accountability, and go see at the gamble where things happen. Lean thinking to become a lean system strive to eliminate waste. Waste is non-value added resources and activities. Value is defined by the customer. Are you providing the value you should be providing? Givens for Lean, there are two main pillars of Lean: continuous improvement. This is why it's generally talk about respect for people, and this is often assumed, but if this is not done correctly, Lean will ultimately not succeed. Quality, employees should take responsibility for the quality of their work and be empowered to stop the process and correct any errors. While true Lean experts know the importance of the second Lean pillar, even if they don't think of this as a separate pillar. Many others only focus on the Lean tools included in the continuous improvement pillar. Implementing many Lean tools is easy. The real challenge comes from the change in culture. That is required to truly incorporate respect for people and ultimately to sustain the success. Management and metrics must be developed and used in such a way to show true respect for the employees. Lean is not about cutting jobs, and Lean is not mean, but without respect for people, it can easily turn into this. In order for Lean to work, quality must be a cornerstone. This is often understood, but it is important to stress its significance. Principles of Lean let customers identify value. Our organizations provide what customers really want. A product or service is not just an object, but a whole experience. Identify the value stream. Value stream sequence of all activities and resources required to bring a product service to customers. Make the value stream flow, create smooth and uninterrupted flow for products processes. Pull from downstream. Operations are performed when needed, not before. Always pursue perfection. Continuous improvement in a way of life. In typical manufacturing firms, 60% to 80% of costs are administrative costs. In United States healthcare, 75 cents of every dollar are spent on non-patient care related activities. Similarly, waste still occupied the greater portion in most work environments. In general, only 10% to 30% of work is value added. Lean outcomes, healthcare, clinical lab results, Urgent Health, Nebraska. a 60% reduction in turnaround time without adding headcount or new instrumentation. Keystone General Hospital, Ontario, Canada, 70% reduction in instrument decontamination and sterilization cycle time. Dignity Hospital, Pennsylvania, 95% reduction in patient deaths related to central associated bloodstream infections. Ohio Health, 800,000 increased in annual surgical revenue. Orthopedic surgery, state care, Wisconsin, reduction of patient waiting time from 14 weeks to 31 hours. First call to surgery. Overall, Canada, South Dakota, 29% reduction in patient length of stay, avoided 1.25 million in new emergency department construction. Park Nicollet Healthcare Services, Minnesota, in 2004, 7.5 million from the rapid improvement events. This is a video about function 1 versus auto car, fixed car efficiency improvement. Reduced lead time. Lead time consists of value-added and non-value-added. Continuous reducing cost. Traditional costing method. Cost plus profit equal to price. Lean costing method. Price minus cost equal to profit. How is harder to apply lean thinking in healthcare lab manufacturing? Who are the customers and what do they value? In visible work, patient encounters often involve a process or decision as an outcome. More privacy issues. How does healthcare differ from manufacturing? Organizational and professional culture issues, professional autonomy, teamwork, and systems thinking, mission-driven, non-profit orientation, production of social goods. How is healthcare similar to manufacturing? Process dependence, huge variability, often unjustified, aversion to standardization, pressure to innovate and use new technology, need for high reliability systems, patient safety, lack of embedded testing, no instant awareness of aviator, $1 trillion industry, continuous quality improvement orientation. In this thinking, value is defined from the customer's point of view. However, the value is sometimes hard to clarify. Before trying to make any improvement, it is critical to know what your customers want. What would you be willing to pay for during a hospital stay? A VA is value added, such as hospital room, doctor, nurses, electricity to run monitoring equipment. NVA is non-value added, such as cost of patients with no health insurance, cost of hospitals insurance premiums, cost of empty hospital beds, cost of expired medications or supplies. NNVA is necessarily non-value added, such as cost of radio, TV, web advertisement, cost of delivery truck signs, cost of hospital manager, cost of cleaning, cost of hospital errors, employee training, profit. What do healthcare customers want? Best medical care possible, convenience, show time on phone, show wait for appointment, and care when needed. Fast, efficient, caring service, clear communications, choice, value for money, affordable cost for the patient. The 7 ways plus 1. Ways in healthcare. Any activity that does not help patients or does not move them towards treatment or discharge. Eliminating waste allows employees to spend time doing their primary work, direct patient care or patient care support. This video is short of relevant you. It is easy to missing something you are not looking for. Waiting description, people or operations waiting. Examples in healthcare, patients waiting to see their physicians. Employees are waiting due to uneven workloads. Early morning admits for surgery that won't be performed until later in the day. Excess processing description. Unnecessary processes and operations traditionally accepted as necessary. Examples in healthcare, hard copies of memos already sent by email or posted on intranet. Redundant capture of information at admission. Multiple recording and logging of data. Information put on forms that is never used. Defects of rework description. All processing required creating a defect or error and the additional work and time required to correct it. Examples in healthcare. Fixing errors make it documents. Inspection. Missing items on a surgical case card. Unreadable handwritten orders. Wrong medication or wrong dosage. Motion description. Employee movement that is unnecessary, that does not add value, or that is too slow or too fast. Examples in healthcare. Physicians and nurses leaving patient rooms for common supplies or information. Poor placement of equipment or tools. Excess working by lab employees due to poor layout. Overproduction description. Producing more work than required, or producing work prior to it being required. Examples in healthcare. Unnecessary for duplicate procedures. Medications delivered too early. Just in case blood draws. Inventory description. Unnecessary or excessive storage or accumulation of materials. Examples in healthcare. Overflow or expired supplies. Unnecessary instruments in operating room kits. Expensive clinical supplies and implants that can be ordered on a just-in-time basis. Unused hospital beds or exam rooms. Transportation description. Any excessive or unnecessary movement of a product, patient, specimens, materials. Examples in healthcare. patients being transported throughout the hospital due to poor layout, moving supplies into and out of a storage area, moving equipment for surgeries in or out of operating and procedure rooms. Non-utilized talents description, disconnected between functions, having highly qualified people performing the work and paperwork. Examples in healthcare, not engaging or listening to employees, not having staff contributing idea for improvements, not cross-training personnel. Easier to remember acronym is downtime. Lean tools and techniques, just in time, JIT, 5S plus 1, various stream map, VSM, and so on. About turning to lean tools and techniques, we introduced two popular tools, 5S plus 1 and VSM. 5S is a philosophy and a way of organizing and managing the workspace and workflow with the intent to improve efficiency by eliminating waste, improving flow, and reducing process unavailabilities. A systematic way of creating a safe, efficient, and highly visible workplace for employees. 5S left-hand side is Japanese terms versus right-hand side is English terms. Sort, setting order, shine, standardize, sustain. Latest plus 6S is safety. Sort, when in doubt, move it out. Weeding out unused, unneeded items. Creating guidelines for item removal. Use red tag to clarify land removal. Setting order, a place for everything and everything in its place. Established locations, visual control with labeling. Shine, to be lean, you must be clean. Basic stream cleaning. Inspect equipment, creating standards to keep it clean. Shine involves cleaning the target workplace area and using this process to inspect the workplace and equipment for defects and safety hazards. Standardize. Standardize is to improvement, guidelines and checklists. Make standards visual. Standardize is creating visual controls and guidelines for keeping the workplace organized, orderly, and clean. Standardize, visual control. To show respect for standardization is too necessary to make the management of the area visual. In real situations, we don't know if something is missing beforehand. So we search and search to try to find it. Is it missing, or can we just not find it? Either way, we have wasted a great deal of time and energy, leading to frustration. Sustain. Sustain for success. Management reinforcement, audits, culture. Sustain involves training and instruction employees to follow the guidelines creating in the standardized step. This step requires management reinforcing the importance of an organized workplace. 5S audit should be explained to the staff. The 6S safety. Educate workers on safety issues. address a potential safety hazard. 5S is an excellent lean beginning step. It is intuitive in many aspects and therefore relatively easy to learn and implement. For example, middle managers were able to apply this tool in their work areas after simple training. 5S can involve many employees, which serves to uh, disseminate lean principles and approaches into the organizational culture. Its results are usually achieved quickly and are very visible, making the first lean ever a clear success. What ways did you see in this picture? Do you have a clear sense of what process was happening in the space? Is there a sense of orderliness or organization? How would you feel as a patient in an emergency room, as a family member, as a doctor or nurse? In your opinion about the care provided influenced by the atmosphere of the emergency room? Salt and shine. Drawer before and after 5S. 7 plus an hour a day. Exam room setting order. Biomed before and after 5S. 5S results. Nicolette Health, 94 items involving 397 employees. A total of 40,415 red tags items were sent to the 5S warehouse. Items deployed, sold, donated, or thrown away. Items valued at 1.2 million. Lean tools and techniques of value stream map, VSM. What is value stream? A value stream involves all the steps, both value added and non-value added, required to complete a product or service from beginning to end. Material flow, a movement of the patient through the value stream. Information flow, communication or transfer of information that occurs to enable the patient to move to the next step. Value stream map, VSM. A value stream map is a visual representation of a value stream. Helps you to see and understand the flow of material and information as a product or service proceeds through the value stream. A tool used to support achieving a lean future step process. Why use VSM? Purpose, visualize the work, build team consensus, point to problems, focus direction, attributes, focuses on patient customer requirements, use a systems perspective, leads work and information flow, documents metrics of delivery and quality performance, documents work complexity by showing different types of services flowing through the value stream. Allows process design to meet specific objectives. What does VSM help? Value stream mapping allows us to see the West, gain an understanding of the current state at a much deeper level. This is an example of VSM in emergency room, Houston, Texas, 32,000 annual visits. Current state, total cycle time average, 19,424 seconds. about 324 minutes. Total value added time average 7,680 seconds, about 128 minutes. Value added 39.5%. VSM improved quality, visual state, total cycle time average 12,331 seconds, about 206 minutes. Total value added time average 6,172 seconds, about 116 minutes. Total necessary value added time average about 5,359 seconds, about 89 minutes. Value added 57%. Adding a physician to the triage assessment area will allow for patients that do not need further care and evaluation to be discharged quickly, allowing more room to be available for the ones that do need further care. Also, moving a physician to the area will allow for secondary registration to be done by all patients so that the hospital can charge as soon as the patient is seen. The following routes are based on the typical patient route through emergency department. Increased capacity 35%, increased total patient capacity 30 per day. Potential increased revenue 27,000 per day, or about 9 million per year. Diversion rate reduced to 10%. Leave west being seen reduced to 1%. This report shows total potential capacity increase, not potential volume increase. The Junior Medicine Production System, VMPS. In 2002, VMPS adopted the Toyota production system philosophies and practices and applied them to healthcare. Customer first, highest quality, obsession with safety, highest staff satisfaction, a successful economic enterprise. For Junior Medicine strategy plan, we exist because of the patient. A living document, a plan that could resonate with all staff and that could grab onto and say, I know what this organization is all about. I know where we are going and why. The panoramic, an iconic map, a decision tool, a living document rooted with the DNA of the organization, a shared vision. A VMPS tool, rapid process improvement workshop, 7 to 10 staff offline for 5 days. Patient on the team, when possible, take a process and engineer using cycles of plan, do, check, act. Improved process should be patient-centered, health waste and waste eliminated. Seattle's Virginia Mason Medical Center is an integrated healthcare system. 2013, 9,058 million in annual revenue was 500 million in 22. 336 bed acute care hospital, 9 neighborhood ambulatory care clinics, 460 physicians was 400 physicians in 22. 6,000 employees was 500 employees in 22. 9,400 inpatient hospital admissions annually. 18,000 surgical procedures annually. Graduated medical education program research center, 44.7 million expenses. Skilled nursing facility for people with AIDS. The VMMC quality equation Q equal to A multiply outcomes surface over waste. The impact of Lean, half the human error, half the space, half the equipment, half the inventory, half investment, half the engineering hours, half the new product development time. We finish at serious quality and safety web educations, which these issues and methods help you hospital to improve quality and safety. Wish you have a good time. Bye-bye.